everyone. Thank you so much for joining us on today, our Women's Health Summit. Our topic for today is fibroids and fertility. My name is Joy Jose, and I am your host for this session. I'm a civil rights attorney, a mental health advocate, and I actually have my own show on this platform that talks about all things mental health and wellness. Thank you for tuning in. Before we get into this discussion, I would like to introduce you to our esteemed panelists. While you're tuning in, while you're checking us out, drop in where you're calling from, where you're listening in from, and what you hope to get from this conversation around fertility and fibroids. We want to hear from you, we want to interact with you, so let this be a discussion. Thank you all for joining. So first, we have Jessie Thompson. She is also affectionately known as Coach Jessie Thompson. She is all about health and wellness, and I cannot wait till we dig into some of the things she has on her platform, toolkits, nutrition, shakes. I was excited looking at it. She is also a nutritionist and founder of the Detox Now. We also have the honor of having LaToya Dwight in this conversation. She is the founder of the Fibroid Pandemic. She is a fibroid warrior, and she has lived experience in this exact arena. We also have the luxury of having Dr. Tiffany Jones join us today. She's a women's health advocate, a fertility doctor, and she's a board-certified OBGYN. She is one of D's Magazine's best fertility doctors for 3 years in a row now. I was very impressed. And finally, last but not least, and we may have others join the conversation, we have the honor of having Dr. Matthew Seidoff join the conversation. He literally just left the OR, and incidentally, he was operating on fibroids. He is a professor, an OBGYN, and currently the vice chair for gynecology at Cedars-Sinai. He's been described as incredibly caring and compassionate, which is exactly what we want in doctors. So before we go forward, I just want to thank all of you for joining this conversation. It is especially critical when we talk about women's health, Black women's health, that we talk about fibroids and how it can affect fertility. So before we get into a lot of the technical and medical definitions of fibroids and treatment, it is so important that we share our stories. I think a lot of what happens with fibroids, it being underdiagnosed or even misdiagnosed, is that people forget, especially Black women, how common it is, or people just do not have that access or don't know. As I'm sure everyone on this panel knows, it is a common reproductive condition. Up to 80% of women will develop at least one fibroid by the age of 50. And like I said, there's really power in our stories. And I'd like to start with Coach Jessie and LaToya Dwight to just talk about experiences that you may have had with fibroids. First, when did you first become aware that something could be wrong? What brought you to this place in your journey?
Thank you so much for having us. I always say, you can't talk about fibroids enough. Literally, I can talk about it every single day throughout the day. Fibroids really, for me, became a part of my life when I was on my fertility journey. I just had, I was married 4 years in. I was happy and ready to expand my family. And, when we decided, I don't know if you guys are planners like me, but I was like, okay, we're going to start with just getting to know, spend each other, being happily married. And then we're going to expand the family. The next in this year's and 30 years old came, and it was time. It was time on my calendar. Guess what? It wasn't happening. 6 months in, no contraceptive. It's not happening. So I would say the control freak in me made me go a little earlier than the technical definition of infertility, which is a year of trying without conceiving. 6 years in, I went for a checkup, and my OBGYN said, oh, it looks like you have fibroids. And I was like, what? What does that mean? All the questions came flooding in. Will I be able to have a child? Or tumors? Oh, that's scary. Is it going to kill me? And scary about what that could mean for my life ahead. And it really precipitated a journey of actually 14 years battling fibroids that caused an infertility journey of 10 years and, 5 surgeries for fibroids, 5 surgeries for complications from the fibroid surgeries, 5 IVF cycles,
Mhm.
even a devastating miscarriage, and my heart stopping on the delivery table. Um, but thankfully, I did. I am one of those really blessed people that my miracle did actually end up in a life who is now the joy of my life, being born Mia Madison Thompson. And she actually birthed me into this work.
Mhm. It's so amazing how our journeys can actually be what heals others. I
Absolutely.
don't consider it's unfortunate that pain and suffering is a part of our experience, but I do think that it's powerful when we turn our pain into purpose. And I am so grateful that you are so transparent with your story. And I'm also grateful that you didn't wait for the technical year before you decided to seek help. Latoya, what was it for you that made you want to look into things deeper? Did you have symptoms or what was it? Was it pain?
That's a great question. First and foremost, thank you so much for having me here. I know there can be tons of other people who sit in this seat right now, and I'm just really grateful to be here amongst all of you all. So, my fibroid healing journey was very unique in that I had no idea that there were fibroids on my uterus. Quite frankly, um, I wasn't having any known symptoms. And I'm doing the quotes because hindsight is 2020. After going through research and realizing what's going on, you later realize, oh, that's what those symptoms meant. But initially, I had no idea that there were fibroids on my uterus. So for me, it started when my now husband, when he and I were first dating, we both agreed that we did not want to have an unplanned pregnancy. So I got an Marina IUD. Within a certain number of years, the IUD needs to be replaced. I went to go get the IUD replaced, and my OBGYN, who I had been going to for over 12 years, she couldn't locate it. So she asked me to go into ultrasound. Now, painting the picture, this is all within the same exact doctor's office visit. So we're talking probably about an hour and a half max. So when she sent me the ultrasound, this is within her office suite. It wasn't at a hospital setting, it wasn't offsite. This is literally within her doctor's office visit setting. So I went to ultrasound. The ultrasound tech, they performed a topical ultrasound, was unable to locate the fibroid. I'm sorry, unable to locate the IUD.
Hmm.
So they did a vaginal ultrasound, and the IUD was right there front and center, because initially the doctor kept asking, did you remove it? Did you remove it? And at that moment, I'm like, I didn't know you could remove an IUD. So I was really confused. So when the ultrasound tech found the IUD front and center, she's like, oh, there it is right there. I'll make sure I let the doctor know. And as gathering my items and put my clothes back on, she goes, oh, by the way, how are your fibroids coming along?
Oh.
And I go, what's that? And she's like the look on her face, she was mortified. So she just very casually was like, oh, no big deal. I'll let the doctor talk to you about it. So I got back in there with the doctor, and she's just kind of going through the regular procedure of having to put me back on the schedule to have me come back so that they can then try to remove the IUD, because at that time so much time had passed by and my visit was pretty much over for the most part. So I go, okay, well, hold on. Can we talk about those fibroid thing, that fibroid, those fibroids, or whatever it was? Because at that time, I was so ignorant to the word fibroid or uterine fibroids. So very casually and very cavalier, the doctor's like, oh, yeah, that's right. So the ultrasound tech did identify some fibroids on your uterus, and they're rather large. And if you like, I actually recommend that we go ahead and get you scheduled for hysterectomy.
Wow.
And she just kind of went forward with the actual trying to get me on their calendar. And I was like, time out. Can we back up a little bit? And like, first of all, can you explain what fibroids are? She never
Mhm.
explained that they are non-life threatening, first of all. She never explained that they are non-cancerous tumors of the uterus. And she never explained the statistics of those humans with the uterus who will develop fibroids, and how Black women are disproportionately impacted by uterine fibroids. Never mentioned any of that.
Mm.
Nor did she mention any other type of solution, whether it's going the holistic route or minimally invasive, non-invasive, or major surgery. She just went straight to hysterectomy, the first and only option. So that was very off-putting. I asked several questions, and she was very almost non-helpful, unhelpful. So I get in the car, I called my then boyfriend, and I'm like crying about it because I had no idea what I just got diagnosed with. All I know is that I'm leaving a regular doctor's visit, standard visit, that I was expecting to have my IUD replaced, and now I'm leaving with the diagnosis of having fibroids, and with the recommendation to get a hysterectomy. Now,
And Latoya, that's so common. I'm so sorry to cut you off because I
no, you're
want
fine.
to make sure
You're
that
fine.
people hear that. I so often hear the story that one of the first things that they're told by the healthcare professionals is a hysterectomy. Coach
Yeah.
Jesse, I don't know what your first response or recommendation was, but when you were diagnosed with uterine fibroids, what were some of the initial medical responses as treatment?
Number one was surgery. Now, because I went specifically to, I was trying to conceive, they said I needed nothing minimally invasive. Mind you, I had never had not one surgery in my life. And I had no symptoms, as Latoya spoke about. My only symptom was I wasn't able to conceive. And at 30, they say, oh, you might develop a tiny little pooch. I was a size 2. And I mean, when I say tiny, it was tiny. But hysterectomy is the number 2 performed surgery in the entire United States. When you're talking about number 2 performed across all surgeries for men and women, right? For human beings, period. And half of them don't have uteruses. So that tells us that there's something going on there. That is the surgery that Latoya would be recommended. That is crazy.
Yeah,
It's just
and I see
absolutely
some
crazy.
people asking in the comments, they're always going to hysterectomy. Is that the only treatment? We're going to get into other options. Thank God
Oh
we
my
have
God. There's
doctors
so
on this
many options.
because there are, yes, there are other options. Sometimes surgery is necessary.
Yeah.
Oftentimes not as necessary as we may think. So stay tuned for the other options. And before we pivot again to medical treatments, stigma, history, I want to touch on some things that I think also keep women from seeking out, especially Black women, the truth about what's going on or keep them from checkups. Let's talk about initial reactions and how you navigated those initial reactions, whether it was fear, shame, sometimes guilt. This is our womanhood, right? Is what we're told. This is what makes us women. The ability to reproduce, which is honestly a very heavy and unfair burden, to be frank. But how did you navigate those initial and even persisting feelings of guilt, shame, fear, anger? What were those feelings?
Toya, do you want to start? You want me to?
Yeah, so for me, I had an onslaught of emotions, embarrassment because I did not have the proper tools to articulate what the diagnosis was that I just received. I didn't have the wherewithal to understand what my body was experiencing. I felt like my body had betrayed me, to be quite frank. And I also was confused. I was confused because I couldn't understand why a doctor who I had been going to for over 12 and a half years, why she didn't give me any other information. I honestly, at that very moment, I thought I had a very great relationship with her, but at that very moment, I literally felt like a number. And it added to sadness, to be honest with you, and disappointment because, we entrust in these doctors and we're putting our livelihood in their hands. And to be met with a cavalier type of attitude, it was extremely disappointing. And lastly, I emotionally and mentally, it left me in a state of feeling like I had been abandoned. So, dealing with all that, literally all at one time, it was a lot to deal with all within a short amount of time.
Coach Jesse,
I
could you
think
repeat or what was your experience?
absolutely. So I will echo everything Latoya said so beautifully. The other thing that was a critical piece was the isolation because of the shame. So feeling like you have something to hide, right? The feeling something's wrong. And the biggest thing is, oh my God, nobody's talking about it. So we're totally in silence, suffering in silence. You know, in the work that I do at the Detox Now, I speak to women every single day who unfortunately have these conditions. The fibroids have grown severely. Why? They didn't come, they didn't stop to seek treatment until things were so bad that they're in a devastating position because of fear. A
Mm,
lot of fear, a lot of shame. Okay. Shame that, and also another big thing is feeling like not just feeling like, being told that their symptoms were normal all along, being told that the heavy bleeding is, oh yeah, you just bleed heavy. All right, when heavy bleeding is like one of the number one signs, hey, something's wrong. The menstrual cycle is a vital sign, right? That something is wrong. It's an indicator. But they're being told that, oh well, black women, let's not get into the bias, black women just bleed heavier, right? Or they, you just may experience more pain. So when you have those layers, what happens is, not only is our pain being dismissed, not only are our symptoms being minimized, but we start to minimize them ourselves because we start to feel like, am I crazy? Am I being too much? Is this normal? You know,
yeah.
I recently wrote a book called In Fibroids Manual and Guide because I said, oh my God, I need to put the book in the hands of women I wish I had when I was going through this. Latoya, you didn't you feel like you had to be a research assistant, like a researcher, excuse me. You had to collect the information. You had to go through so many different sources. You had to become a lead researcher instead
Mhm.
of there being sources where it's like, oh, okay, I know what I'm going through. Like, oh, okay, now I know what all my options are. Oh,
Mhm.
okay, I understand the implications for me as a Black woman and why I'm experiencing this. Oh, okay, I know what the none of that was present. So I said, oh, I need us to know that
Mhm.
we don't have to be alone anymore. Okay, because that was a key thing, feeling alone, feeling alone, and like you literally had, the way I like to say is, you're in a plane crash. You have to fix the plane and fly the plane at the same time, right? Because the resources are not there, the support is not there, and the information is not there. But
Can I just add
now
to Jesse's
that can,
point?
mhm, yes.
I'm sorry, I didn't mean to cut you. I want to just add to your point about feeling like you have to become a researcher. That's very, very true. Like there were little to no resources out there. And it's almost as if I had to become a so to speak, doctor. You start, I've read scholar articles on my own. Some, to be 100% honest, I understood, and some I did not.
Mhm.
White papers, medical journals, etc., until you really start to understand what's really going on with your body. And that silent suffering is very critical. People don't realize that that is very traumatic in and of itself.
And this is why we have these conversations.
Mhm.
This is why we have the Women's Health Summit, because there should no longer be, in the age of information, that kind of silence. There should no longer be, in the age of information, that kind of shame. And this is also why we have experts on our panels, people with lived experiences and people who have read those pages and written those pages and can maybe help us decipher those pages. Dr. Matthew, Dr. Tiffany, again, thank you so much for being here. And thank you so much, Coach Jesse and Latoya, for sharing your stories. And especially, we want to shout out to the audience for people who are sharing those stories. Those of you who've experienced heavy bleeding, those of you who had hysterectomies recommended to you, those of you who had partial hysterectomies. Thank you for sharing this story. We uplift your stories, we hear you, and we hope you feel empowered throughout this. But I want to get into the let's talk about it. Let's illuminate this. Dr. Seidoff, can you talk to us about what fibroids are and potential reasons why they're so common amongst Black women?
Sure. First of all, thank you for the opportunity to visit with you all and participate in this. It's a humbling experience. As you can tell, I'm neither Black nor a woman. And so, I have to approach this, with a lot of humility and respect for the experience of people that go through something that, I can't personally relate to. And so, for those that have had the experience of having their symptoms dismissed or not being given the full array options that are available for treatment. So I just apologize on behalf of our specialty. There's no question that is true. And I see it all the time for people that either just want to get a second opinion and have found me that way, or get referred from other people. And they'll tell me a story of, I saw such and such, doctor, and wasn't told that I had options here, and I'm really looking for something different. So, I completely respect that story, and I know for sure it's very, very common. But to just answer your question, I don't think we know why the fibroids occur more commonly amongst Black women, but it's definitely true, both in terms of a little bit in terms of the amount of women that experience uterine fibroids, but also, what's probably more important is it's more likely for Black women to have more numerous fibroids, for them to grow larger, and to have greater symptoms associated with them, like heavy bleeding and even anemia as a result of that heavy bleeding, or what we call bulk symptoms. So as these fibroids, they can get really, really large over time, and they can start to push on other things. So like bladder frequency is a common symptom, or just feeling a protrusion or pressure in the lower abdomen. But what they are, they're benign tumors that are made up of muscle tissue. The uterus is a muscle. As it grows during pregnancy, one of its functions obviously is labor, and during that you have contractions, and so it's made up of muscle tissue to undergo labor. And just like cells in any part of the body, they can sort of make mistakes as they divide and turn over. And when that happens, you can get abnormal growths. Sometimes you can get benign tumors, like things on the skin, or cancerous things, like colon cancer or something like that. But it's all a matter of just the cells not properly dividing and forming, so they form these tumors. And so in the uterus, it's made up of muscle tissues. The tumors that can form there are made up of that kind of tissue. And like I said, they can grow to be quite large, but also their location within the uterus is important. So as they get closer to the lining of the uterus, the part that sheds with the menstrual period, they tend to cause more issues with bleeding or fertility. And then just size in general, they cause more of those bulk or pressure symptoms I described before.
Thank you for that insight. And again, I understand why the reviews of you talked about caring and compassionate. We appreciate the work that you do, and we also appreciate you giving space to people who have lived this. Dr. Tiffany, I want to turn to you because Latoya mentioned something so interesting to me that I think we need to think about. She didn't feel symptoms. She didn't feel the traditional symptoms. But what are some symptoms that we should be mindful of? I know Coach Jessie talked about heavy menstrual bleeding, but what else?
Yeah, so as Coach Jessie said, and again, thank you so much for having me, but like Coach Jessie said, heavy bleeding is one of the number one symptoms that a woman may have, but other symptoms can be pressure, bulk symptoms like feeling your tummy, feeling like your pants can't close, bladder symptoms. So people who drink just a little bit of water and have to go to the restroom immediately, or even constipation and sometimes diarrhea. So what we call gastrointestinal symptoms can sometimes be attributed to fibroids. Infertility, that the uterus is what holds the embryo, what grows and nurtures the embryo. And so people who struggle to conceive, that is sometimes a symptom of that, is having a fibroid in a place that does not permit those things to happen. So those are some of the symptoms that are, overt, and then some are just subtle. Like you wouldn't think that having to urinate frequently or pee frequently would make you it would be a fibroid symptom, but the bladder is in the front of the uterus, and so a mass pushing on it would make it hold less urine and thus make you go more frequently. So people have to be very sensitive in getting a history. Your doctor has to kind of elicit those things because they may not be something that you even recognize.
Important. So there are a myriad of symptoms that can be indicators, not necessarily, but indicators that you may be carrying uterine fibroids. We also talked about how when you are planning for fertility or planning for a child, that's when you often get checked. But I'm a Black woman. when should I get checked? Should I wait till I feel symptoms? Should I wait? Is there such a time as too early? When should Black women get checked for fibroids?
So I would say that OB-GYNs, our American College of Obstetrics and Gynecology has kind of failed us in navigating us through how to really screen for these diseases. So when myself and the other doctor were matriculating through school, we learned to do a bimanual exam, right? So on different body habitus, you may not feel a fibroid. We never do ultrasounds, even if someone has symptoms. We usually start with something like birth control pills to control just the symptoms. There's so many women that I see who go to their OBs every year and they have complaints, and it maybe something's too subtle, and it's the first thing is to try to treat the symptom. But that's actually how we are trained. But we know that 80 to 90% of Black women and even 50 to 70% of other women will have these. So not to get an ultrasound as a first line detection, especially when it becomes more widespread, like it's in most offices, or just the referral would be quite easy. You know, that's really how we were trained. At least that's how I was trained. And I was trained at USC and he's at Cedars. So I know we were trained very similarly. And it's even in our kind of our guidelines. And so I think for the OB-GYN community, we really have to, you know, yes, maybe the treatments are not incorrect, but people want to know why they're having these things. And then that conversation can extend to incorporating the patient's thoughts of how they would want to manage what the actual diagnosis is, and not just masking things with birth control pills or other things that can treat the symptoms that the patient is experiencing.
I love what you said about incorporating the patient's thoughts. But yes, Coach Jessie.
Yeah, so what Dr. Tiffany said is just so critical, right? And I would love for us to stigmatize the heavy and painful period, right? Stigmatize it and understand, wait a minute, that's a red alert. I need to look at that. And so that we are actually looking at things earlier, because it could be a hormonal imbalance before it becomes fibroids, right? 65% of people who've been prescribed the birth control, hormonal birth control, are on it for non-contraceptive reasons, for PMS symptoms, as Dr. Tiffany mentioned. And that is to mask the symptoms, right? To shuts down the hormonal process, which is so critical to how many other processes in the body, right? So I think when you talk about reframing the approach to me needs to, let's back into stigmatizing what the signs are, first of all. And I totally agree to making ultrasounds standard of care, right? Because you may not feel, they may not be palpable. Guess what? You may have back pain. That was one of the symptoms. Pain during intercourse may be one of the symptoms, right? If it's back pain, it's what? It's posterior located, and you may not feel it in the manual exam, the physical exam, right? But it's still present, right? So I think it's really important for us to just, because I think about what listeners can do. Because I posted something this last week, and it was a woman wearing a diaper, okay? And with a pad, an extra overnight pad in the diaper, saying, this will take care of it, right? And I was heartbroken when I saw that, because there's so many women who say, yeah, that's what I have to do too. Yeah, that's what it takes. And we needed to have the red alert stop sign so far before that. So far before the time where it came to having loss that can lead to life-threatening anemia, right? As Dr. Matthew mentioned, that we have to stop way before that and say, okay, wait, let's reverse it at the prevention level. Let's reverse it before. And I know we'll probably talk about what are quote unquote, root causes. And I would definitely want to get into that conversation in terms of what research has shown us versus what is being officially, donned correct.
Yeah, and I'm also curious, thank you so much for that, about let's destigmatize these types of conversations, but stigmatize the normalization of symptoms that can be indicators of there is a problem.
Yeah.
There are some things that we need to stigmatize. Doctors, I'm curious if you've heard of diet contributing to the growth, multiplication. I know you're a nutritionist, Coach Jesse, so you can probably also speak to this, but in your medical research, have you seen diet as a contributor to it? I know friends who have fibroids who have cut out like dairy, things of that nature. I don't know if you've heard of any contributors that are linked to diet.
I'm not aware of any good evidence in the medical literature that says that we know that certain foods are connected to fibroid growth. I will say, at least anecdotally, I've had patients experience fewer symptoms when they change things in their diet. So avoiding things like gluten, dairy, processed foods, caffeine, alcohol. I've definitely had patients say they feel better. And especially if we're trying to non-surgically manage fibroids, some of those things I think can be important.
As a nutritionist, Coach Jesse, or even Latoya, were there some things that you did in terms of your diet or some lifestyle changes that you made? Maybe you can hear from you first, Latoya.
Absolutely. So that's definitely true what you mentioned, doctor. Definitely changing your diet is very critical. But one thing that I do always recommend is that, eliminating dairy products, red meat, fried foods. I'll admit, yes, I do steal a French fry off of my husband and my son's plate every now and then. But for the most part, I really try not to eat any fried foods because, to your point, it does really intensify the fibroid bulk symptoms. But one thing I want to point out, I was vegan at one point. I'm no longer vegan in the vegan community. Sorry, because sometimes they'll attack you for no longer being a vegan. But I will say, the vegan lifestyle has not been proven to prevent fibroids 100%. I have clients that I've spoken to, several, who have been vegan all of their lives, actually, and they still develop uterine fibroids. So getting back to what Dr. Jones was saying earlier, and what Coach Jesse also mentioned, I really think taking it back to the basics and incorporating these discussions in school, in the classroom, educating and including that in our health education courses. So when these young women start having these symptoms, they are able to advocate for themselves when they go to the doctor, if they feel as though they're being gaslighted because it's normal that you're having a heavy period. So to your point, yes, definitely changing your diet, but it's critical that people understand that just because you follow one strict regimen is not a guarantee that you will avoid fibroids 100%. It's not a guarantee.
Yeah. So just love this conversation. Latoya is absolutely correct. You can be vegan and absolutely have fibroids. No question. Why? Again, we break down, I can't go into a whole bunch of detail, but in the book End Fibroids, we really break down key things that research has shown in terms of studies around what are key contributing factors. Estrogen dominance being one, which is driven by diet, and before that, stress. Many of the women who I've heard who had, maybe a great diet had very high, maybe it was trauma growing up, stress in terms of their high-paced, fast-paced lifestyle. Stress was something that was a key contributor to growing the development and the growth of the fibroids in their specific case. When you look at what was going on in your lifestyle and we would trace them in our consultations, what was going on at this period, right? The other thing, which is huge, is that 76 vitamin D deficiency has been strongly linked to the growth. And there's an inverse relationship where the lower the vitamin D, the greater the occurrence and the symptoms of fibroids, right? And when you look at the vitamin D hormone, which is one of the root factors we detail in the book, that it is literally one of the most powerful hormones that fight and restrict the growth of fibroids. And it's been shown that in research. And here it is with Black people of melanated skin, is that 76% of people, African-American people, have been shown to be vitamin D deficient. Because why? Our melanin blocks the absorption of the UVB rays that the body uses to convert through the gut and the kidneys to make the vitamin D hormone. All right. So we are by nature more prone to vitamin D deficiency because of you're blocking the absorption of the sun. Your body's producing less vitamin D, and most of us don't get that midday sun, which is where the UVB rays are emitted during the midday sun, the highest altitude of the sun. We're at work. We're not outdoors. We're not sunbathing. We're outdoors. Why? Because
Also, yeah.
so what happens is we have to supplement. We talked about this recently in terms of preventable health issues. Every person of color, obviously, if you are very light skinned, you may need 10 to 15 minutes versus someone who is more melanated, who needs more sun to activate your melanocytes. However, the key thing is we all need to be supplementing when it comes to vitamin D, especially when it comes to fibroids. And then there are other major health issues. And then there are endocrine disruptors. That is a huge other factor. So it's not one thing. There are genetic components because there is the variation in the COMT1 gene that can cause you to upregulate the way that you process estrogen. Okay. That happens. That makes you now, Latoya, you may eat dairy and you feel your symptoms go crazy. If I don't have that variation in my COMT1 gene, I may consume dairy and, I don't have those symptoms because I don't have that upregulation happening in my body, right? And then going to endocrine disruptors, the environmental work group did a study recently. They're the one that do the clean 15 and the dirty dozen list. They did a study recently that showed 78% of products that are marketed to Black women, of beauty products marketed to Black women, contain harmful toxins connected to cancer, hormone disruption, and reproductive damage. Okay. So now, there have been all these studies about, hair relaxers. Yeah, that's one source of endocrine disruptor.
Exactly.
I did a study. I did literally not a study. I did a scan, and it's in my IG feed because I know I can't go into all this. We did a blog on the detoxnow.com called Are Your Beauty Products Killing You?, which goes into this, but I'll just go quickly into it. I did a scan one Sunday morning. I was like, I'm feeling pretty good. I've gone natural, Toya. You know what I'm saying? Like I've taken out those toxins. So I'm feeling like my products, I've got all these natural products. They're going to be clean, right? But I was just, for the fun of it, let me scan these products. There are apps out there that allow you to scan for endocrine disruptors, phthalates that are present that you wouldn't know looking at the labels on the products, right? I did that scan and I was mortified. I was mortified at the huge shopping bag of products, brand new bottles I had to throw away. And they were gels, shampoos, lotions, conditioners, hair oils were better off. But the good thing is I did find products that were clean. So I just threw away all the stuff that I was like, I can make that change. I can make that switch. And I can.
And how amazing that we live, again, information age where you can literally.
That's what I was saying. You don't have to be in isolation. You have a fibroid pandemic. You have the detox now. You have just even the community right here. You have people who have learned and are providing information for you to now, for your floor to be our ceiling. Okay. And, there are easy switches that you can make to eliminate, not every endocrine disruptor, but major one that could be the contributing factor for you, right? And then there's inflammation, which is a whole other thing, obesity and inflammation. So again, we break all that down in the book, and fibroids, and I highly recommend it for anybody who's going through it. We wanted a manual for you.
I tried to tell you in the beginning that she has so many goodies. Please check out her handle. That's how you can find her.
All this living we did, it's got to be for something, right, Toya? Like you're going to get something out of this experience.
Absolutely. I agree 100%.
Sharing that, especially what you're saying about vitamin D. There's a physiological and biological component, but there's also a cultural one, right?
Yes.
Colorism.
Oh my God.
We were born with it.
Why did you go there?
Go out in the sun.
Go there.
We have to go
had
there.
this conversation yesterday, Joyce.
Yeah. So there are a lot of things at play here. Yes, there's our cultural stigmas that we've been told. There are biological ways that we take in the sun and vitamin D. So supplementing is really important. I've seen a lot of questions about, okay, if it's not a hysterectomy, what other treatments are available? Dr. Tiffany, can you speak to other options, and Dr. Seidoff, any options that you perform? I know that you both know about and perform minimally invasive surgeries. What other options are available?
So there are medical options that treat symptoms that basically shut down hormones that may feed the fibroids or start the menstrual cycle to allow bleeding to occur if that's the major symptom. But as far as procedures, it really depends on where the fibroids are located. So the number one procedure that I perform as a fertility specialist is called a hysteroscopy. Hyster is uterus, scopy is camera. So we put a camera inside of the uterus to remove fibroids that are inside the womb where a baby would grow, because those are the number one types of fibroids that cause infertility or decrease fertility. And so that is a minimally invasive procedure. It's a day surgery. And you go home the same day and then can commence trying to conceive or whatever it is someone wants to do. And then usually that treats bleeding as well, because those fibroids also are the number one causes of heavy bleeding. If a fibroid is in the muscle layer of the uterus, it's not accessible by a hysteroscope. So a minimally invasive surgery like a laparoscopic myomectomy or robotic assisted myomectomy, or even an open myomectomy, which is a larger procedure performed just like you would do a C-section, would remove those fibroids that are not accessible from the inside of the womb. But those take a little bit more time to heal from, but they all have in common that they preserve the uterus. They just remove the culprit. I had a patient who had very tiny fibroids and one very small one in the uterus, and she was only 22, and her doctor recommended a hysterectomy for her. And I was just like, this is crazy.
Yep.
So yeah, like, it's not that people are making these stories up. They actually
Not
happen.
making it up, Tiffany. Tell them.
No, that happened to my
know.
niece. She was
Yeah,
in 22, I think, when her doctor diagnosed her with fibroids and recommended hysterectomy. That's when I
crazy.
really amped up my research. I'm like,
And we
there's no way.
we know that there are options. The other options that are that don't remove the uterus but can treat the fibroids and potentially treat symptoms of bulk or bleeding are a newer procedure called the Sonata, which is a ablation technique that heats up a fibroid and through an ultrasound that is put into the vagina. It is done under anesthesia, and I perform this procedure sometimes on patients who really want to avoid surgery, and that will heat and treat and kill a fibroid and may shrink it to a point where you can't see it, or at least prevent it from growing any further. Acessa is another procedure that's very similar, but it's done laparoscopically, again with heat. And then uterine fibroid embolization, which is done by an interventional radiologist, where they block the specific arteries that feed the fibroids to prevent them from growing and to kill them. But not all of these are, from a fertility standpoint, things that I highly recommend for people wanting to conceive, because they're newer and we don't really have all the information of how it's going to affect fertility. But what's tried and true is removing a fibroid if those fibroids are deemed to be causative for infertility. And for sure, there are so many options women have to treat that are not a hysterectomy. But some people do need hysterectomy. So I also don't want to shaming people who choose that for a route, because I know from my patients, and you see this young face, okay? I have not been practicing that long, okay? But even I have seen women do a myomectomy with my own hands. I removed everything just for 2 years later for them to come back. And then they're on this little roller coaster, and people get tired, and people complete their families, and people want peace. And so I do want to know, even from a fertility standpoint, a hysterectomy is an option. It is not the first option, but all options should be presented to the patient. And then it's the patient's choice to make sure that they're doing what's best for them.
I really appreciate that. There is hope. There are options for treatment. There is hope for fertility, if that is your plan, if that's your goal. And it does not have to be the removal of your uterus. And guess what? If it is a hysterectomy, there is no shame in that.
That's
just
right.
to make sure that you're talking about all options. Dr. Seidoff, I want to go to you. We have a few minutes left before we get to hear how we can find y'all, but I do want to turn to you. what if we're still afraid? We've heard all these things, but we're still afraid. What are some potential long-term risks if we don't face the facts and get our fibroids checked or treated?
Yeah.
What are some
Yeah.
potential risks?
Yeah, it's a great question. And I think it speaks also to the importance of, as a physician, not being, we talked about being dismissive of symptoms or even not bothering to ask the question, when somebody says, are your periods normal? And then you go on to ask, well, how long do they last? Or, and you get a history. Well, that's not normal, when you actually ask the question. So I think that's really on us as physicians to take that time. And I completely agree with having a really low threshold to investigate with, with imaging, ultrasound, or sometimes we get MRIs for these, and being able to diagnose them early, because you're right, they can have important health consequences. And, it may be that you pick up on a fibroid before it becomes a really big problem, and maybe there's nothing to do for it right then, but then you know about it and you can track it over time. And so, you see a 2 or 3 centimeter fibroid. Okay, well, we know it's there. We don't need to do anything right now, but we should sure check on that the next time you come in for your annual exam. And if you see it's the same, then you can continue on just observing it. But if it grows from 4 centimeters to 6 centimeters, and then the following year to 8 centimeters, that's when you start to think, okay, maybe now is a time to start thinking about when we need to do something about this before it gets out of control and can cause some other serious health problems. So we've been talking a lot about heavy bleeding. It can certainly get to the point where you can get significantly anemic, to the point where somebody might need a blood transfusion because they get so bad. And because it happens over time, your body sort of adjusts to that lower level, but you experience a lot of negative effects as a result of that. You don't have the energy levels you're supposed to have, having to sleep excessively, not being able to exercise because your body doesn't have the stores that it needs, because of the excessive bleeding. So, and then other things that can happen is fibroids can actually get so large. Occasionally I've seen it happen where it can not just push on the bladder, but cause the bladder to be obstructed. Or the tubes that carry urine down from our kidneys to the bladder, they're called the ureters. They can get obstructed as a result of that, and that can lead to potential kidney damage. They can even be associated with blood clots in the legs by putting pressure on the blood vessels that bring blood back from the legs back to the heart. And so it's not uncommon. It's not common, but I've definitely seen it a handful of times in my practice where patients come in, their initial diagnosis is this blood clot, and then you recognize that it's related to the fibroids. And what gets tricky there is then they have to be on blood thinners for the blood clots, and that makes the bleeding worse. And you sort of get into the cycle where if you had just picked up on this earlier and sort of been on top of managing this, so it didn't get to that point.
Knowledge is so powerful. Thank you for that. Knowledge is powerful. Catching these things early increases your chances of optimizing your options and optimizing the outcomes that you want. So don't let the fear of visiting a doctor, of finding out the truth, keep you from finding out the truth. Coach Jessie, Latoya are living proof that when you do get connected with the right resources, with the right access, you can have the things that you've hoped for and you've prayed for. It isn't the case for everyone, but you do optimize your outcomes when you catch it early. We are just at time, but I know there are a lot of questions about how people can connect with you further. At Coach Jessie, is this your handle? Can they look you up for social media with this handle?
Yes, and I highly recommend, one thing that wasn't talked about is alternative options. And I can tell you, we were just on Angela Yee's Way Up with Yee last week, where one of our clients talked about how she eliminated a 10 centimeter fibroid that was MRI documented before and after through our lifestyle changes program, which was nutrition, coaching, herbal supplementation, daily practice changes. So it is possible. Look into it, because it is possible. And we are here to help you, because I don't believe in watchful waiting. I know it's a medical, protocol, but I believe that let's identify it sooner, and let's not look at the 2 centimeter and watch it, because let's say, hey, I don't want to go any further. I want to go backwards. So let's look at eliminating it when it's in intervention stages.
It is your health. Advocate for yourself with the healthcare professional. Take authority over your health. Latoya, we can find you at that handle at the Fibroid Pandemic. I know you also have a foundation. Thank you so much for your work.
Absolutely.
Dr. Tiffany, how can they find you?
So
Do you
I practice in Dallas, Texas. I am at Conceive Fertility Center, and I am on Instagram, not as active because unfortunately I'm very busy because everybody has fibroids. And so you can find me on Instagram at tjonesivfmd.
Thank you. And Dr. Seidoff?
Yeah, I'm also not really on social media either. I just don't
was
have
just in the OR.
the time, or there's only so much time in the day. But at cedarsinai.org is where we're located, and we have a minimally invasive GYN surgery division that specifically focuses on these options for treating fibroids. We do a lot of surgery that used to be done through big open incisions. We now do minimally invasive to give people a lot easier recoveries after these operations.
Awesome. Thank you all for your work in every sphere.
Could we just end with one bomb? Ask the medical professionals this one question, because I've heard this and I want to make sure this is not misinformation people are hearing. Is it true that the UFE is a one and done silver bullet that once you get it, you'll never have fibroids again? Can you answer that question?
Absolutely not. No. And
Thank
I think
you.
So the answer
one
is
sad thing is sometimes people, they go to see a radiologist for this and they're not given proper counseling. It can be a great
Thank
procedure
you.
to avoid surgery for some people, but there are people who are not good candidates, and they need to be
That's
told
right.
that.
Mhm.
You're just
That's
wasting
right.
your time and your money, and it's a painful
Say it again.
procedure. You really need to look at some other options when that's
so the
not.
short answer is no. Look at other options, get second opinions.
Yeah.
Thank you all so much for your work. Stay
Before we go, can I say something really quickly before we go? I'm sorry. I didn't really properly get a chance to just, tell people they could follow me at the Fibroid Pandemic. But one thing, I'd be remiss if I did not mention this. Through my fibroid healing journey, I realized that there is very little community activism out there. So I have curated my very own 5K run walk. It's called Run FAR. FAR is an acronym for Fibroid Awareness and Resources. It's a 2-day event. July 14th in Atlanta is a panel discussion, and on the July 15th is the actual 5K run walk. So go to runfar5k.com and all the details are there. My goal is to grow this over the future coming years. So I want to be certain to make sure I mention that before we log off.
Run Far 5K. Please look it up. It is in July. Thank you so much for community activism and organization and empowerment and education. We thank you all for joining the conversation. It will be recorded, so look on our social media channels and stay tuned because we have another panel for the summit. Thank you all again.
Thanks for having us.
Thank
Goodbye.
you.
Thanks for having us. Goodbye.
Fantastic. And right.
Are we back? We backstage?
Yeah,
Can we take a quick selfie?
We're not done.
Girl,
yet.
Latoya, I'm so happy you said that. I was like, yes.
We're still live, y'all.
We're still live, and thank you all for joining. But we can take a selfie live.
All good. You can do the selfie. It's all good. But I wanted to say to our audience, first of all, thank you all. You all were fantastic. Just giving some great information. Particularly you, Dr. Seidoff, just coming straight out the OR to be able to be here.
Yeah, that was amazing.
The dedication and commitment that you have to our audience, and I want to give you your flowers while we're still live here on the air, and just say thank you so much for that. Dr. Jones, so many different types of procedures just that don't end with hysterectomy. So thank you for sharing that. Oh my goodness. So thanks again. Top of the hour. We talked about menopause. We're wrapping up the day. Talk about menopause. So stick with us, Women's Health Center.
Thank you all.